Science often advances in small, steady steps. One study confirms a detail, another fills in a missing piece, and slowly, the puzzle of human health becomes clearer. But every now and then, research doesn't just add a piece, it flips the entire board. The Keto CTA trial belongs to that rare category. Instead of reaffirming decades of conventional wisdom, it forced us to question one of medicine's strongest beliefs: the idea that high LDL cholesterol inevitably leads to clogged arteries and heart disease. For years, the narrative was simple, almost frighteningly so. High LDL meant danger, clogged arteries, heart attacks waiting to happen. Doctors, researchers, and even public health campaigns drilled this message into the public. Keep your LDL low or else. But when the Keto CTA trial unfolded, it painted a more nuanced picture. One where LDL couldn't be judged in isolation, and where the health of the whole body mattered far more than one intimidating number on a lab report. What makes this even more fascinating is a group now officially recognized in medicine: lean mass hyperresponders, LMHRs. These are people who are lean, active, and metabolically healthy, yet when they follow a ketogenic diet, their LDL levels rise dramatically. By traditional cholesterol standards, they'd be considered high risk for heart disease, but in reality, their situation doesn't quite fit those old assumptions. So what exactly did the trial reveal, and why is it shaking up long-held assumptions? To understand that, we need to step back and revisit what LDL really means. Stepping back, what LDL really represents. LDL cholesterol has long been branded as the villain of heart health. It earned the nickname bad cholesterol, and the logic was drilled into the medical system. The lower your LDL, the safer you were. Statins, drugs designed to bring LDL down, became one of the most widely prescribed medications in history on this very foundation. It's not without reason. LDL carries cholesterol through the bloodstream, and under certain conditions, it can deposit inside artery walls, slowly forming plaque. That buildup can eventually narrow blood vessels and set the stage for heart attacks or strokes. But here's the part often left out of the story. Cholesterol itself is not evil. In fact, it's essential. It's the raw material for hormones, a building block for cell membranes, and even a supporter of brain function. Now here's where it gets more complicated. People on low-carb diets often see their LDL climb, sometimes dramatically, but at the same time, their triglycerides drop, their HDL rises, and their insulin sensitivity improves. It creates a paradox. One risk marker looks worse while several others improve. Which one should carry more weight? This is exactly why the Keto CTA trial didn't settle for assumptions. Instead of guessing risk from blood tests alone, it took a direct look inside the arteries themselves using coronary CT angiography. Imagine glancing at a car dashboard versus lifting the hood to check the engine. CTA is that deeper look, what the scans really showed. If the cholesterol model were as straightforward as we've been taught, the results should have been obvious. High LDL in ketogenic eaters, especially LMHRs, should have translated into rapid plaque buildup. But that wasn't the case. The scans revealed something surprising. Despite LDL levels that would make most doctors alarmed, LMHRs did not show the runaway plaque progression predicted by traditional models. Their arteries weren't clogging in the way we would expect based on LDL alone. Of course, not all ketogenic approaches look the same. Some versions rely heavily on saturated fats. Think butter, bacon, and fatty cuts of meat. And as Healthline points out, eating too much of these can raise cholesterol and, over time, increase the chances of artery blockages or strokes. In other words, it's not just the carbs you cut out that matter, but also the type of fats you choose to replace them with. Why oxidized LDL matters more. LDL by itself is simply a transport vehicle, a delivery truck carrying cholesterol around the body. The real problem begins when those trucks break down. That's what happens when LDL becomes oxidized. Oxidized LDL, or OXLDL, is the damaged, unstable form that tends to stick to artery walls, triggering inflammation and plaque formation. And what drives LDL into this harmful state? The culprits are familiar: smoking, poor diets heavy in processed foods, high blood sugar, chronic inflammation, and environmental stressors. In short, it's not just the number of LDL particles, it's how vulnerable they are to damage. Here's where things get even more interesting. Many LMHRs and keto followers, despite their high LDL, have relatively low levels of oxidized LDL. Their metabolic health works in their favor. They have low inflammation, stable insulin, and robust HDL, all of which reduce oxidative stress. In this environment, LDL particles may be abundant, but they aren't easily turning into the harmful form that accelerates heart disease. So how do you know if your LDL is the harmful, oxidized kind? Some doctors measure it with a blood test called an enzyme-linked immunosorbent assay, ELISA. As Medical News Today notes, these tests are sometimes even available online, with samples processed at local labs and results reviewed with a healthcare provider. It's not a routine test, but it can give a much clearer picture than total LDL numbers alone. Think of a highway full of trucks. If every truck is in good condition, traffic flows smoothly. But if those trucks start breaking down and causing accidents, chaos ensues. High LDL without oxidation may not be the catastrophe we once assumed. CAC Scores, a clearer window into heart health. Now, let's talk about another powerful tool: coronary artery calcium CAC scores. When doctors really want to see what's happening inside the arteries, they often turn to this test. Think of it as a scan that checks how much hardened plaque has built up over time. It offers a much clearer picture of hidden risks compared to just looking at cholesterol numbers. And here's the important part. As a study in JACC Cardiovascular Imaging, a peer-reviewed medical journal, explained, CAC testing isn't just widely available. It's been studied in detail and is considered one of the most reliable markers of early artery disease. It even helps predict both stroke and heart disease risk. That's why international guidelines now use CAC results to guide big decisions, like whether someone should start preventive treatments such as statins. Why old beliefs no longer fit? For decades, the equation was simple. High LDL meant high risk. It was easy for doctors to measure, easy for the public to understand, and it helped drive effective treatments in many high-risk groups. But easy doesn't always mean accurate. The Keto CTA trial forces us to think differently. If people with extremely high LDL are not developing more plaque than their peers, then LDL alone cannot be the ultimate driver of heart disease. Other forces, oxidized LDL, inflammation, insulin resistance, lifestyle factors, are shaping outcomes just as powerfully. This doesn't mean LDL gets a free pass. In many contexts, especially where metabolic health is poor, it remains a strong predictor of risk, but it does mean the one-size-fits-all model has to go. Medicine must ask better questions. How healthy is the patient overall? What do their scans show? What is their oxidized LDL level? How much inflammation do they carry? These answers matter far more than a single lab result. What keto followers should take away. For people embracing ketogenic or low-carb lifestyles, the trial delivers a mix of reassurance and responsibility. The reassurance is clear: a high LDL number on its own does not automatically spell doom. Instead of panicking, it's an invitation to look deeper through advanced lipid testing, oxidized LDL measurement, or imaging like CAC scoring. But with reassurance comes responsibility. Keto isn't automatically safe for everyone. While many thrive and improve their cardiovascular health, others may still face risks. It requires monitoring, context, and personalized care. The big takeaway is that health cannot be reduced to a single cholesterol value. It's a web of factors that must be understood together. The bigger picture for medicine. The Keto CTA trial isn't closing the book on cholesterol, it's opening a new chapter. Instead of fear-driven narratives, it encourages us to embrace a model of medicine that respects complexity. Future risk assessments won't just be about hitting cholesterol targets, but about tailoring decisions to each person's unique context, their genetics, diet, inflammation levels, imaging results, and lifestyle. The key reminder from this research is simple. Cholesterol can't be judged in isolation. Yes, LDL matters, but context matters even more. Your metabolic health, inflammation markers, and artery scans tell the full story. Science itself is alive. What seemed certain a generation ago may now feel incomplete. That isn't weakness, it's progress. For those following a ketogenic path, the takeaway is crystal clear. Don't let a single lab number define your health. Ask deeper questions, look at the full picture, and work with providers who understand the nuances of modern science. Health is personal, and so is your journey. If this perspective gave you something to think about, share it with others who might need the same clarity. Thanks for watching, and I'll see you in the next one.